Now to the coronavirus pandemic. Federal health officials say Americans have severely weakened immune systems can get a booster shot. Less than 3% of the population.
Hello, today I present to you an extremely attractive application for music lovers. It's completely free. You can listen to music online or download unlimited music to use whenever you don't have internet. The powerful search function helps you find anything you want. Trust me. It's hard not to find what you're looking for because the search function is really powerful. Application download link is attached in the description of the video. I'm pretty sure you'll like it. Thanks.
Is immunocompromised, and not all of those people are eligible for a third dose. The decision comes as the summer surge worsens. It's being driven by the highly contagious Delta variant and has prompted heated debate over face masks for students heading into the new school year. Mark Strassmann has more.
Outside Atlanta, a deja vu clash in a deja vu crisis.
The CDC is corrupt.
I believe in my own science and our own studies.
COVID has exploded in Cobb County schools, Georgia's second biggest system. On August 6th, the first week of classes, 253 cases. A week later, it's tripled, more than 800 cases. The hotspot, Eastside Elementary, almost 50 cases in 2 weeks. Every fifth grader sent home after an outbreak.
Your kid's been exposed.
Not surprised, not shocked, but still very devastated.
Teenie Christman has two sons at Eastside. Her older boy, a third grader, was exposed to someone in school with COVID. She's getting him tested. But school quarantine policy would let him go back to class right away without a test. Just wear a mask for 10 days.
How worried are you until you get the results?
Very much. We're checking the email.
Today, Atlanta's Grady Memorial Hospital changed its status. Total diversion. Please take new patients elsewhere. On June 20th, 7 COVID patients. Today, 103 COVID patients. Every ICU and emergency division bed is spoken for.
You will have patients waiting in the hallway.
Dr. Robert Jansen is Grady's chief medical officer.
The exponential growth of cases is just staggering. It's more rapid than what we saw even in the sort of third wave of the winter of 2021.
Florida is COVID America's biggest mess. Schools in Palm Beach County today sent home more than 1,000 kids for possible exposure. In Broward County, 3 teachers died of COVID within 24 hours.
It's extremely frightening.
Florida leads the country in new cases, new COVID hospitalizations, and in pediatric hospitalizations. Yet Governor Ron DeSantis refuses to bend on his ban against mandatory masking. Today, the CDC approved something new, a third shot of the Pfizer and Moderna vaccines for some of the 7 million immunocompromised U.S. adults. Cancer patients, transplant patients, and people with advanced HIV infections could start getting those shots this weekend. Back in Georgia, these Eastside Elementary parents feel lost. Their kids too young for vaccinations, and a school board that also says no new virtual schooling.
Because they are playing with our children's life.
It's nerve-wracking.
It is.
Here's why those third shots recommended by the CDC matter so much to all those immunocompromised people. They get 1 of every 3 hospitalized breakthrough infections. And Elise, we heard again from Teenie Christman. She got the results of her son's COVID test. It was negative.
Mark Strassmann, thank you. Dr. Sejal Hathi joins me now. She's an attending physician and faculty member at Johns Hopkins Bloomberg School of Public Health. She's also the host of the Civic RX podcast. Dr. Hathi, thank you for joining us. Analysts predict at least another 100,000 American lives will be lost by the end of this year. If true, what does it say about how bad this upcoming fall and winter could be, and can it be avoided?
Well, firstly, Elise, thank you so much for having me. And I read the same report that you're citing now. It's a really troubling reflection of how much we have regressed in this pandemic. And I believe it. We are now facing across the country rising case rates, hospitalization rates, soon to follow death rates. And that's largely a pandemic of the unvaccinated. Unfortunately, only about 50% of the US population is fully vaccinated. That is nowhere near where we need to be. And unless and until we rapidly and dramatically escalate our vaccination rates, unfortunately, we're going to continue to suffer. More people are going to die. And our kids, as we prepare to go back to schools and as parents prepare to return to the workplace, are going to bear the brunt of the consequences.
The FDA has authorized a third dose for some immunocompromised Americans who receive the Pfizer or Moderna vaccines. And the CDC also backed that decision Friday. Who will this affect, and what do they need to know about getting this additional shot?
Yeah, so we saw yesterday the FDA gave its approval, and the CDC committee today endorsed that decision as well. The CDC estimates that 7 million Americans, that's just under 3% of the US population, is immunocompromised. Who are these individuals? They comprise anyone from organ transplant recipients to those with primary immunodeficiencies, that is, they're born with immunodeficiencies, those with acquired immunodeficiency diseases such as advanced and untreated HIV/AIDS, according to the criteria outlined by the CDC today, as well as patients on hefty immunosuppressive treatment. So immunosuppressive drugs, even steroids, hefty doses of those for autoimmune diseases, as well as active cancer therapy. And these are the individuals that the CDC has stated are eligible for this third shot. But happily, it seems that they're also allowing for these individuals to use a so-called honor system, whereby an individual himself or herself must attest to having one of these conditions or an equivalent immunocompromising condition in order to receive these doses from pharmacies or from their doctor's offices. So it allows a little bit of nuance for individuals themselves to think about this and to discuss this importantly with their physicians, who may be able to provide further guidance as to whether or not it makes sense for them at this time.
My own mother falls into that category. She was trying to get through her doctor today about everything that you just mentioned. Now, the CDC says an estimated 1.1 million people have received an unauthorized additional dose of the Pfizer or Moderna vaccine. Is this dangerous to do without approval from health officials?
That's an excellent question. And I would say it's challenging and concerning for a few reasons. One, those individuals, the 1.1 million individuals that you mentioned, which is probably, frankly, an undercount from what other data that we're seeing. But those individuals are receiving shots in an unsupervised fashion, where we don't know what happens to them after they receive this third shot. They're not being supervised by a physician or at a testing center. We do know that in some rare cases, individuals can experience various allergic or other reactions to a vaccine. And so when they're getting this under the table, so to speak, it's harder to monitor for those reactions as well as to document them. CDC's Dr. Rochelle Walensky said a couple days ago, earlier this week, that those who are getting unauthorized vaccine doses compromise the CDC's safety monitoring system. And then the final reason this is challenging is that we are already seeing such tremendous inequities in vaccine access throughout this pandemic. And unfortunately, it is those individuals who are savvier, who are better connected, who are wealthier, who are more likely to go ahead and prematurely procure these third unauthorized vaccine doses. So it's those who are most vulnerable who are least likely to get these additional doses, and that just exacerbates the inequities that have already sorely characterized this pandemic.
So sad. Pfizer says it has sent preliminary data on booster shots for the rest of the population. How likely is that this will be necessary for the average healthy American?
Yeah, so I, like you, have been seeing the changing data on this very question. It seems remarkable that just a few months ago, we were being told that there is no way that anyone was going to get a booster or a third vaccine dose, let alone the entire population. But now it seems that's only a matter of time. And we can only look to some of the other countries that are already doing this for obviously the immunocompromised, but also high risk, essential workers, the elderly. I think that it likely will happen here too over the course of a couple of months. The CDC is collecting data, additional data every single day. And once it becomes clear that those who are not immunocompromised are seeing additional breakthrough infections, once we reach that threshold, then it's likely that boosters would be authorized for a remainder of the population. But I think it's just a matter of time. So I'll be watching the data as closely as you do over the coming weeks and months.
Well, thank you for breaking all of this down for us, Dr. Sejal Hathi.
Of course. And I do want to note one thing. It's imperative that those who are not immunocompromised do wait. I know that we are all impatient to get the safest and most effective treatment that we can. But right now, the data does indicate that the vaccines are safe and effective, even against the Delta variant, if you are not immunocompromised. So if you do not fall into one of the categories that the CDC outlined today, just rest easy, wear your mask, practice safe public health guidance, and we'll wait to see what the data shows.
A strong message. Thank you, Dr. Hathi.
Thank you.